We're just going to wait a couple of minutes before we begin. Thank you. Thank you once again for joining us. We're just going to wait a couple of seconds before we begin. Thank you. Good morning, good afternoon, and good evening. A very warm welcome to you all on behalf of the Sightsavers events team. We are very much looking forward to supporting you during today's webinar towards a disability-inclusive COVID-19 response and recovery, learning from practice. We would like to open with a few housekeeping notes before handing over to our co-chairs today, Jazz Shaban, the DPO Engagement Manager at Leonard Cheshire and one of the Bond Disability and Development Group co-chairs, and Gordon Rattray, International Cooperation Officer from the European Disability Forum, who will welcome you to the session. Okay, so we are delighted to offer international sign interpretation for today's session. For the best sign interpretation experience, we are presenting in speaker view, as we will be spotlighting the speakers and sign interpreters' videos throughout. If a presenter is screen sharing, watching side-by-side mode so you can resize the interpreter's video by dragging the vertical divider. We are delighted to also offer closed captioning in English for today's sessions. You'll see on the Zoom menu bar the closed captions button. Please click on this and show subtitles now if you'd like to view the captions. To increase the font size, click on subtitle settings, where you can move the slider to adjust the size. And to view the full caption transcript, click on Show Full Transcript. I'll just wait a moment for you to switch on the captions. Please note there is a few seconds delay with the captions as we've engaged a live captioner for accuracy. So thank you to our live captioner and interpreters for your support today. Please be aware that this webinar is being recorded and will be available to watch and share via the Inclusive Futures website post-event. And we would like to encourage you to use social media channels to promote and engage a wide audience with this event. So please use the following hashtags: IDPWD 2020 and Inclusive Futures. Following our opening speeches and presentations, we'll be inviting questions from the audience. Please add all your questions to the Zoom Q&A throughout the webinar. So similar to the chat feature, you'll find the Zoom Q&A button that is available in webinars on the Zoom menu, and we'll aim to answer as many questions as possible. And finally, the Sightsavers events team are here to help you with any accessibility or technical difficulties. So please contact us using the chat facility on Zoom or email admin@sightsaversevents.com and we'll reply to you immediately. I'm now delighted to hand over to Jazz and Gordon to welcome you to the webinar. Thank you. Jazz, you're muted.
No, I'm on mute.
Okay, thank you, Jazz. Over to you.
Thank you. I will start again. Good afternoon and a very warm welcome to everyone who's joined us today to this Disability Inclusive Programme webinar, which, as had already been said, is jointly hosted by Bond Disability and Development Group, known as DDG, and the Foreign and Commonwealth and Development Office. My name's Jazz and I co-chair DDG, and I also support the engagement and participation of disabled people and organisations of disabled people in Leonard Cheshire's influencing activities. So for those of you who aren't familiar with BOND's Disability and Development Group, we are a consortium of NGOs working in disability and international development. DDG has around 430 members from about 40 UK-based organisations whose principal role is to influence government and other stakeholders to ensure people with disabilities are considered in all international development policies. We are really pleased to be joining the FCDO once again to celebrate International Day of People with Disabilities, albeit a bit late, to focus particularly on some of the emerging findings from the FCDO's flagship disability inclusive programs and to share some lessons on their successes and what can be done elsewhere. So we hope you enjoy today. I'm going to now pass over to Gordon.
Thank you very much, Jazz. So, and thanks, Debbie. My name is Gordon Rattray. I work for European Disability Forum, EDF, on international cooperation. EDF is an organisation of persons with disabilities, so DPO and OPD, and we represent over 100 million people with disabilities in Europe. As well as our work inside Europe, we also advocate to the EU and other relevant stakeholders that their international cooperation, external action and humanitarian action outside Europe is disability inclusive. And for example, in 2019, we launched our new international cooperation strategy. And later that year, consulting with many of our members, we produced a guidance note on the role of European DPOs in international cooperation. This guidance note aims to help ensure that persons with disabilities are meaningfully engaged in this field, not just as beneficiaries, but also as experts. And all of this international cooperation work that we do on disability inclusion is, of course, working in collaboration with and not replacing our DPO colleagues, both in Europe and in non-European countries. Jazz.
Thank you, Gordon. So to get us off to a really great start, it's my absolute pleasure to introduce our keynote speaker today, Vijay Ranajan. Vijay is the Director General of the Americas and Overseas Territories of the Foreign and Commonwealth Development Office, and most importantly, from our point of view, the most senior official responsible for disability inclusion at the FCDO. Previously, Vijay was the UK ambassador to Brazil, and we're very much looking forward to working with you and DDG. So Vijay, the floor is yours.
Great, thank you. Thank you so much, Jazz. Just checking you can all hear me. And thank you again to Bond and the DGG for hosting all of this, and to my many colleagues in FCDO who are working on these issues. It's been a really tough year, hasn't it? And we've been looking at what's been going on and seeing really clearly the unequal impact of COVID. It has really set back development in many areas. It's particularly set back gender equality. It's knocked years of education in many countries of children's education. It's set back our work on girls' education, and it has certainly worsened equality when it comes to the work on disability. COVID has been an inequality magnifier in a really difficult way. So that's the bad news. The great news, and this is just to say thank you to so many of you who have flexed the programs you're working with us with, who have changed the way you're working, and who have helped us cope with what's been quite a spectacularly difficult year. What we're now doing is looking ahead. How on earth do we build back better and greener and more equal out of this circumstance we find ourselves in now? We've got some great policies. We have some amazing evidence. And again, I think, Jazz, you mentioned it, but some of the work that's been done to give evidence as to what works has been incredibly useful and will be even more useful as we go now. The merger of FCDO, while it's internally quite complex and difficult, and these mergers always are, does let us really bring this together in a big way. So the development spend that we have, the diplomacy we're putting around it, the platform to really raise these issues on the world stage. And so thank you to the DGG for helping us do that and for giving us your ideas and telling us when we're getting it right and when we're getting it wrong. And that would be really, really important. It's an important internal issue for us as well as an external one, by the way, and we've just been obviously going through the International Day of Persons with Disabilities, doing a whole lot of events around that, and really fascinating. And we have some particularly inspirational people, actually, with disability working inside the office. We've done a lot in the past, and DFID in particular did a huge amount, and the UK as a whole did a huge amount internationally. We aim to continue to do that. It's really important. And I think that's made even more important by the effect of COVID. And we're looking at this in several different ways. I think one of those is the concept of resilience, real societal resilience. Now it's COVID hitting unequally. Our strong analysis evidence is that things like climate change also hit really unequally. So next year is the year of the G7, the UK's presidency. It's the year of COP26, when obviously, again, we're hosting that. And we're spending a huge amount of time working with countries in their own commitments in all of those bodies. And we will be making sure that disability is a central part of all of those. Because I think one of the lessons out of this is if you don't make it part of your wider policy area, and in many areas of the world, it doesn't become part of your policy area, and it really, really needs to be. The Global Disability Summit in 2018 was great, and we're looking forward to working with the Norwegians to the follow-up summit in, I think it's 2022. So that's the next stage then beyond this great year of 2021, which we're about to enter. Thank you to all the speakers coming here, and you all know much more about this than I do and are much more plugged in. So I'm really looking forward to hearing and understanding your points of view. I feel slightly nervous doing this, but just a couple of thoughts in advance of that. First of all, we're going to have to get better at generating the data and the evidence. As you said, Jazz, we've got Disability Inclusive Development Programme and UK Aid Connect. Really important to actually understand what works and where we can have the greatest impact. Second, mainstreaming this through all of our work, and I've mentioned COP, but I mean, girls' education, a major program will continue. There is going to be a gigantic, I hope, reform of global health next year. I mean, the reason's obvious, but we're leading work in the WHO on WHO reform and much more broadly, prevention of future pandemics and strengthening global health systems. And that, I think, is going to be a really important vehicle for also mainstreaming and disability there. Third, it's been crucial that we have disability champions in organizations, in countries of the world. They have political voice, and we listen to them. So that is, again, going to be part of our policy direction and the activity that we do. And finally, and most obviously, and this brings you back to the DGG, is including and listening properly to organizations of people with disabilities and ensuring that they're meaningfully involved. So I'm glad lots of my colleagues are on the line. We're listening really carefully to all the ideas that you have. And thank you very much for sharing those with you. I think it's been, I just returned back to where I started, it has been really such a tough year. We're all hoping 2021 with a vaccine, with the restart of our economies, with, I hope, some really good news coming on climate change. We've got a great big summit on Saturday, is going to give us a lot more optimism. And I think if I can come back to this, is as we rebuild from this time, making sure that disability is one of the absolutely key challenges that we are tackling and including people as much as we can over the course of 2021 and then further on. So thank you very much, and thank you for having me.
Thank you very much, Vijay. This is Gordon again. Especially pleased to hear your positive tone looking forward and the opportunities that disability inclusion brings to well, the the wider work in general, but especially towards disability inclusion. So thank you for that. Let us now hear from our first speaker, who is Dr. Vladimir Chuk. Dr. Chuk probably doesn't need to be introduced to many of us, but for those who don't know him, Vladimir has been working for the rights of persons with disabilities for more than 20 years, from establishing a grassroots organization of young people with disabilities in war-torn Yugoslavia to the position he now holds as Executive Director of International Disability Alliance, so IDA. Vladimir is going to speak about the importance of OPDs and how critical it is for development programs to include them in meaningful participation. So Vladimir, the floor is yours.
Thank you very much, Gordon. It is great to be really introduced by a friend such as yourself, and to be at the same meeting with so many friendly faces. Thank you very much for including me and the IDA. So basically, historically, DPOs have been excluded from disability inclusive development. Some of the organizations were included ad hoc, and that was happening based on the needs and the prioritization of different international NGOs. This definitely resulted in the fact that this inclusion was sporadic and definitely unsystematic. So it also resulted in the fact that CRPD was not included fully across the implementation of these projects and programs that had as a goal to promote and advance rights of persons with disabilities. Furthermore, if I may say, we believe that results of these projects that were run without DPOs did not have sustainability component in it. So basically what we saw from the ground is that when international NGOs implement projects, change is happening, but then as soon as projects stop or very soon after, we saw usually that the change stop happening. This was all challenging and changed with the start of the program Inclusive Futures, which for the first time at the systematic level, with number of international NGOs and DPOs collectively trying to change this narrative. This project is funded by DFID, was funded by DFID, now FCDO. And really what this project did, which was unique and different thus far, it positioned DPOs at the center, it positioned them at the governance level, and also at the national and local implementation of the project. So there is a governance level at every country where DPOs are sitting and deciding and contributing and framing how the activities will be implemented. This is groundbreaking, especially because it is at that scale. I don't want to say it was never happening before, but never systematic and never at that scale. And also what Vijay mentioned before, the learning that will be happening out of this systematic approach will be very, very important. Important to say that before the beginning of this project, Site Savers, ADD, IDA, and some other partners joined together and start brainstorming on this. So indeed, DPOs were involved in the phases of planning and now implementation, and we will be involved in all other phases of this project. So this is really fantastic. This program also made mandatory that all DPOs are paid at a reasonable level, and that also reasonable accommodation is included across budget. I think this is while maybe seems small, I think this is a huge step that will be important to be replicated. Now, why it is important to include organizations of persons with disabilities? I really don't believe that we have to speak about that, but let me just say a couple of points. One is because that is the best way and most safe way to ensure that project will be implemented in line with CRPD, and we all have responsibility or at least commitment to ensure implementation of CRPD. DPOs have the best knowledge of the situation on the ground. They know where people with disabilities are. They know what kind of discrimination is happening and what needs to be done in order to change this. And finally, like I mentioned, by including organizations of persons with disabilities, we guarantee sustainability. DPOs were there for the last 100 years in some countries, and they will be there. They will be there. They were there before project started, and they will be there long after project ended. So to really secure sustainability of the results, we need DPOs on the ground. Looking ahead, this is not the only project that is and model, but also I need to mention GLAD, which is a donor coordination mechanism, which also recognized how important it is to have DPOs and position IDA as a co-chair of this coordination mechanism. This really is demonstration of commitment of partners and members of the GLAD to disability inclusive development. Similarly, good news are coming from Norway recently, where a similar model has been applied, where DPOs again are positioned centrally. I will go back to learning and what Vijay said for a second, and we need to really write a lot. We need to write guidance. We need to learn from what is happening in inclusive futures and to support possible replication. We cannot finish this part of the meeting without mentioning COVID-19 crisis and special recovery. We need to recognize that the world made many significant mistakes at the beginning of response. Persons with disabilities were quickly reminded of the strong discrimination that is still alive and kicking everywhere. People with disabilities were denied medical services. They were deprioritized in the provision of like emergency healthcare services. This has to change with the next phase, and especially with the recovery phase and the build back better phase. And also now what is really happening, hopefully starting from these days and in some countries already, is the distribution of vaccine. I think this is all needs to be done in a close collaboration with organizations of persons with disabilities, so that we can learn from the mistakes that we did back in February, March, April. So let's look forward and let's build back better all together, and let's hopefully have much better year 2021. Thank you very much.
Thank you very much, Vladimir, for those wise words, so clearly explaining the why and how that of persons with disabilities being meaningfully involved in all of our development and humanitarian work. Just a quick reminder to everybody that if you have questions, you can put them in the Q&A box, questions about content or for the panelists, and for any queries about accessibility or technical difficulties, put those comments in the chat box. And if I can give our panelists a double challenge of please speaking slowly and clearly, and at the same time sticking to your allotted time, because we're running a little bit over. So just a polite reminder to all of our panelists as we move forward. We truly have a star-studded cast today. Before we hear about experience and learnings of organizations in responding to COVID-19 and in working on recovery from COVID-19, let's hear first from Morgan Banks on disability-related costs and the role of social protection in responding to the pandemic. Morgan is an assistant professor with the International Centre for Evidence in Disability at the London School of Hygiene and Tropical Medicine, where her main research focus is on disability, poverty and social protection. So Morgan, I will now say to you, the floor is yours.
Thank you very much, Gordon, for the introduction, and to the organizers of this event for having me here. So today I'm going to be talking about disability-related costs and the role of social protection. And this is relevant both to COVID-19, but also looking beyond the pandemic. So I'll be talking both about what are disability-related costs, as well as the role of social protection. So this is drawing from a number of studies conducted by the International Center for Evidence in Disability, including the I2I program, which is looking at increasing access to wage employment amongst people with disabilities in Kenya and Bangladesh, and includes a component on extra costs. So some of my fellow panelists will be talking more about this program later on. To begin with a few definitions, when we talk about disability-related costs, there are two broad categories. So there are indirect costs of disability, and these are reduced opportunities for earning. So for example, people with disabilities are more likely to be or underemployed and tend to earn lower salaries when they do work. Additionally, other household members may forego employment or time spent on income generating activities in order to provide assistance to a family member with a disability. There are also what we call direct costs of disability, also referred to as extra cost. So these are additional spending that people with disabilities require for goods and services that are needed for participation in everyday life. These can include medical costs, such as for rehabilitation, assistance devices, as well as other supports such as personal assistance or additional transportation. To give an example of how direct costs work and how they can have an impact on standard of living, I'm going to go through two individuals. Let's say Mary and John. Mary does not have a disability, while John is a wheelchair user. Both of them earn an income of, let's say, $100 per month. And both of them have similar basic costs. So these could be for utilities, for food, for housing. And let's say that these costs come to $70 per month. Now, John also has other essential costs that are needed for him to participate in a similar way as Mary. So this could be for additional medical services, for transportation, if public transportation is not accessible. And it could be for personal assistance. So let's say that these disability-related direct costs cost $25 per month. So for each person, when we take into account their essential costs, Mary then has $30 left over that she could spend on education, leisure, entertainment. However, John only has $5 left over that he could spend on these other items. So we could see here that even though Mary and John have the same income, they do not have the same standard of living. Additionally, let's say instead of $25, the direct costs that John requires are, say, $200 per month, then he will not be able to afford all of the goods and services that he needs, which can then affect participation in areas such as work or education. Both indirect and direct costs can have implications for poverty and standard of living. So indirect costs are mostly captured in traditional poverty measures. So if an individual or others in their households are less likely to work or earn lower salaries, that'll show up in household income. And that might mean that they're more likely to fall below the national poverty line. However, direct costs are rarely captured in traditional poverty measures. But as we saw in the last example, they can be quite substantial. So here we have a study that was done in Cambodia, where when we used a standard poverty line, found about 17% of people with disabilities in their households were living in poverty. However, households also spent about 19% of their income on the types of costs that we just discussed. When these costs were taken into account and the poverty line was raised by that amount, about 37% of people with disabilities were now living in poverty. So we can see that these direct costs can have a substantial impact on poverty assessments. And it's also important to note that this is even still likely an underestimate, because this is only taking into account the costs which people are able to meet, not necessarily all the costs that are needed for full participation. And measuring all the costs needed for participation is going to be one of the focuses of the I2I program that colleagues will discuss later. There are many factors that affect an individual's ability to meet direct and, to a certain extent, indirect costs, and that affect the magnitude of those costs. So there's often a focus on inability to meet costs as being due to a lack of income. And this is certainly true, that lack of income can play a major role in an individual's ability to meet costs. However, there are other factors that are important to take into account when designing programs. So one of them is lack of decision-making power within the household. So we've seen in some of the research that we did in Kenya and Bangladesh, as well as in other settings, that decisions to spend on disability-related services are typically made at the household level, and there may be many competing expenses coming from a limited budget. So the individual's standing in the household and the amount that they contribute to financial decision-making can play quite a role. And there's stigma of disability even at the household level. Lack of decision-making power was a particular issue for women with disabilities who have gender norms on top of stigma of disabilities. Another factor that affects the magnitude of costs and individuals' ability to meet them is that many people are not aware of the goods and services that they required or how to access them. And a lot of this is tied to the poor availability or quality of these needed goods and services. So here we have an example from a man with a hearing impairment in Kenya, who was saying when he became deaf as a child, he didn't go to school for a number of years. And this was due to his parents not knowing where to take him for schooling. And it was only after 2 years that a friend of the family's explained that there was a school a fair distance away that provided schooling using sign language. His parents had never heard of sign language, didn't know that this was an option. So here we see that maybe paying for school was a challenge to meeting this cost, but there was also a lack of knowledge about schooling options that could support this child's education and how to access them. Perhaps if there had been an inclusive school within that child's neighborhood, this would not have been as much of an issue. So COVID-19 can affect disability-related costs in a number of ways. So if we look back at those indirect costs, those earning opportunities, we all have seen how much COVID-19 has impacted employment, both for people with and without disabilities. However, our research showed that people with disabilities can take longer to find a job due to factors such as stigma of disabilities or lack of reasonable accommodations in the workplace or in application procedures. So if a person with a disability loses a job during COVID, they may take a longer time to get rehired than a person without a disability. People with disabilities are also more likely to work in the informal sector, which often lacks typical financial protections, such as unemployment insurance or sick leave. So there might be a larger financial impact of losing work during COVID. COVID-19 is also going to bring about direct costs. So many of the health and social services that people with disabilities need have been disrupted by COVID. So people might not be able to get timely access to an assistive device replacement or repair or to needed health care. And this can in turn lead to indirect costs, such as inability to work. There might also be additional costs that are linked to the pandemic and changes in the way we all have been operating. So we have all been moving to more remote connections, whether for work or for schooling. And while this has been beneficial for some people with disabilities, there can be costs associated with that. And some schools and workplaces have not been adept at covering some of the accessibility costs required for these new arrangements. So social protection is an important strategy for managing disability-related costs, both during COVID as well as beyond COVID. So social protection can cover indirect costs by improving working opportunities through, for example, job training and job matching programs. It could also put in place protections in the workplace, so care and sick leave or unemployment insurance. Social protection can also cover some of the direct costs of disabilities. So cash transfers can improve households' ability to purchase the goods and services that they need, as well as there can be in-kind coverage of different needed goods and services. So health insurance can cover some of the medical costs that we discussed, or there can be the direct provision of an assisted device. However, when designing social protection programs, both during COVID and beyond COVID, there are a number of considerations that need to be taken into account to ensure that programs are disability inclusive. The first consideration concerns the eligibility criteria. So some programs are targeted to people who are living in poverty. However, when making assessments of poverty, it's important to take into account disability-related costs. So we saw from the earlier example that it's not just about the household income, but you need to take into account those direct extra costs that people with disabilities face. Additionally, some eligibility is determined by disability, so you have to have a disability in order to participate. However, we found in looking at many programs that the definitions of disability used are not in line with the UNCRPD, and they could be quite restrictive, leading to the inclusion of only people with certain types of disabilities or very severe disabilities. Also particularly important for COVID is many of the assessments of disability rely heavily on medical professionals who can be limited in the best of times, but are particularly in limited supply during COVID. So using community-based assessments is a better option. Finally, for eligibility, it's important that new COVID-19 programs are coordinated with existing programs. So in some countries, people that receive a disability targeted benefit might not be eligible for the new COVID-19 programs. The second consideration concerns how people apply for receipt of different programs. So it's important to ensure that all the application procedures are accessible, including the facilities, information about the programs and how to apply, as well as communication during the process. It's also important to focus on decentralizing and streamlining the application process. So pre-COVID, there has been issues with people having to travel long distances to application points, or having to go to many different providers to get all their needed documentation. So solutions such as community-based registration drives could improve access. It's also important to train staff on disability to reduce stigma of disability from program implementers, and also providing staff with the supports that they need for effective consultation, such as sign language interpretation. Further, for all social protection programs, the delivery of benefits is important. So the delivery mechanisms should be accessible. With COVID-19, we're seeing a move to more online delivery mechanisms, such as through mobile phones, which can be great if it cuts down on travel for some people, but these platforms must be accessible to ensure that everyone can use them, and alternatives must be in place for people that don't have the necessary technology. Additionally, it's important to transfer the benefit directly to the individual with a disability as much as possible. So we've seen in other settings that many people with disabilities lack control over the use of their benefits when these are not given to them directly. The final consideration is on the adequacy and relevance of the benefit packages for social protection. So it's very important to consider the needs and situations of people with disabilities when designing different benefit packages, whether to address COVID-19 vulnerabilities or for poverty alleviation more general, and to offer adaptations. So for example, it might be that a higher cash transfer is needed to offset both lack of income due to poverty, as well as some of these direct costs. Similarly, for health insurance, it's really important to ensure that disability-related health services are included in programs, which frequently they are not. And then finally, it's important to consider both the financial and non-financial barriers people with disabilities face in meeting basic needs. And to do that, that will involve coordination of social protection with other sectors. As an example, giving a cash transfer to a person with a disability might not mean that they can access the food they need. If, for example, during COVID, the shops that are open are not physically accessible, or they face stigma from shopkeepers in accessing those stores, or if they have an underlying health condition that means that they have to take stronger social distancing measures. So that is a quick overview of disability-related costs and the role of social protection. I'm happy to answer any questions in the Q&A section later.
Morgan, thank you very much for that excellent overview, and also so many practical solutions or practical ways forward clearly explained. So I think that's a great introduction to the landscape. The next 20 to 30 minutes is going to be roughly divided into two themes, where we first look at experience of disability inclusive response to COVID-19, and then look at the recovery from the pandemic. So focusing first on response, we will hear from Betty Chepkarui via a video message. Betty is a teacher by profession and holds a bachelor's degree in special education. She's also a human rights activist and is engaged in the Innovation to Inclusion, the Eye to Eye program, through her work for Albinism Society of Kenya. So Betty is going to explain a process that was used by organizations of persons with disabilities in this program in Kenya to understand the impact of COVID-19, and then to design a data-driven advocacy strategy or advocacy messages for an inclusive response. So let us hear from Betty.
I hope you are well and safe. My name is Betty Simkiri. I'm working with Albinism Society of Kenya and other 9 disabled persons organizations in Kenya in engaging with Eye to Eye project to improve access to services on formal employment and social protection. Our role as a DPO is to identify the UN CRPD implementation in Kenya and to advocate for and lobby the government of Kenya and other private sectors in putting more effort on the commitment to implementation of the same. COVID-19 came as a huge impact for persons with disabilities, and this gave us a leeway to find data, and we did collections of data April of this year to find out, we wanted to find out how persons with disabilities are being affected by the pandemic. So we found that the results that persons with disabilities who were interviewed at that time, 92% of the same were affected in job place and also in the community, where persons with disabilities were discriminated. For example, persons with albinism were looked down upon because of the light skin, and they were associated with Asians because the corona came from Asia, and persons with disability with albinism were discriminated on the same. Now, as we found out the analysis of the data survey, DPOs have come together to really see the way forward on the implementation of Article 27 and 28 of CRPD, whereby we are going to engage the government, the private sectors, in order for them to adjust the workplace and also additional disability costs so that persons with albinism are given opportunities in job places. Persons with disabilities also are in the right place to give the way forward on how the DPOs are being able to even work together with Kenya Bureau of Statistics so that the data desegregation is improved. I want to thank the government of Kenya by putting more effort in this data desegregation so that we are able to get more data and move forward in helping persons with disabilities. Thank you very much.
Big thank you to Betty. I really do hope that you and your colleagues are watching in Kenya. So, continuing in the theme of response, let me now ask Johannes Trimmel to take us forward. Johannes is Programme Director on Disability Inclusive Development at Sightsavers, and he is going to speak about COVID-19 response in the DID programme of Inclusive Futures. So, Johannes, it's now your turn to hear the phrase. The floor is yours.
Yes, thanks, Gordon, and good afternoon, everybody. So when the COVID-19 pandemic and the response strategies hit our partner countries, together with FCDO, we decided to develop from April onwards, actually, a specific COVID-19 response portfolio within the DID program. And I just want to point to one of the figures here that says 600 households with people with deaf blindness supported, which already shows that one focus really is on reaching the even more excluded and underrepresented groups, living up to the Agenda 2030 ambition of leaving no one behind and reaching the furthest behind first. It's a program across all sectors of the DID program, also to kind of reflect the many impacts COVID-19 has in different areas of the work, but also to generate learning in many areas. And that is what I want to share with you in the next couple of minutes. What are the key learnings? I will try to be very brief in the interest of time, but for all who are interested, we have an interim report produced that we are able to share with participants after the meeting. And the learning, I have focused in 4 areas, and the one is leadership of organizations of persons with disabilities. And I just want to highlight 2 things. One is, unlike many other initiatives where people are consulted with and are kind of asked to join a room for consultation, for give feedback on already prepared plans, we really kind of tried to have, and were successful actually in having organizations of persons with disabilities with us all the time, from the identification of the needs to planning the program, implementation and monitoring. And this has definitely increased a lot the quality of our COVID-19 response. So meaningful participation is really a key for us to take from this program. And secondly, also that there's a need to invest in organizations of persons with disabilities, to kind of pay them for what they are doing in programs, to be sure that they are able to participate in a way that's good for them and good for the program. And I would like to introduce now Mr. Asudasaman Chowdhury Rasel, who is the president of an organization of persons with disability in Bangladesh called Rajaniganda Prodipondhi Union Sangstha.
The role of organisations of people with disabilities in cash transfers during COVID-19.
Can you please tell us, how did you select the cash recipients?
After getting information, we drafted a list of financially disadvantaged women with disabilities, families which were headed by women with disabilities, the families of children with disabilities, people with disabilities who were unemployed, and people with severe disabilities. Then we finalized the list in an OPD executive committee meeting. We sent the money from ADD International Bangladesh and communicated with them immediately to confirm they had received the money and withdrawn it. People with disabilities spend this money on food, medicine, to repay debt, or to support their livelihoods. For example, to restart their businesses, for livestock rearing, or to support their small businesses. We also provided them with assistance and advice and checked that the money was used appropriately.
Yeah, just to reiterate kind of how important the focus on reaching the marginalized and underrepresented is, and without OPD involvement, we wouldn't have been able to manage. That is where often humanitarian response fails to really reach all. A second learning from livelihoods is that cash transfers really worked out in our program well to kind of link immediate response to longer term development and the COVID-19 recovery phase. So it was a good tool that we can recommend. And I would like now to introduce Ms. Nasima Akhter, who is the General Secretary of an organization of persons with disabilities called Abirbab Protibon Disaster.
The work of organisations of people with disabilities and local authorities to set up hand washing facilities in Bangladesh during COVID-19.
How did you work with representatives and government officials to set up the hand washing corner?
We communicated with the Upajila administration and Union Council representatives several times, both in person and over the phone, to explain the benefits of the hand washing corner. Then the decision was made to establish the hand washing corner.
How did you select the location of the hand washing corner?
We, the OPD leaders, along with the local administration, visited different possible locations in the Union for the hand washing corner. We chose this location because it is a remote area and people who live here have less access to public services. People who live in this area are getting huge benefits from this hand washing corner, and it's being used by 100 people a day on average.
How has the hand washing corner benefited the local community, including people who use wheelchairs and children?
We have put up a sign to promote the hand washing corner. As people in this community have no access to government services, people visiting from outside the Union Parisad and people who travel here to access the services of the Union Council use the hand washing corner. There are 3 basins and 1 is accessible for wheelchair users and children, so they can use the facilities.
How do you monitor the number of people using this facility, and how do you maintain the hand washing corner?
After selecting the location, we agreed with the Union Council that they will provide soap, water, and cleaning services. A local government staff member is responsible for taking care of this corner. This person also motivates people about hand washing. I informed the Union Secretary about the number of users, and we are given a report at the end of the month.
So I think this was an excellent example to demonstrate how important it is to build relations between organizations of persons with disabilities and governments at the time of crisis. And these relations are definitely also important in the COVID-19 recovery phase to build back better. The last learning I'm not saying much more about because we have heard about the importance of data already, just to re-emphasize and saying what we have learned in our COVID-19 response is really a couple of things that should help and inform people, governments, actors, NGOs to work towards a disability inclusive COVID-19 recovery over the next couple of weeks and months to make sure that nobody is left behind and to build back better. Thank you.
Thank you very much, Johannes, and also thank you to Asaduzzaman and Nasima in Bangladesh. For me, it's also great to hear again about the autonomy that cash transfers can give persons with disabilities when they're done in a participatory and accessible, inclusive way. So Thank you for that. Let us now move to disability inclusive recovery. And first to speak here, I told you we had a star-studded cast. We have Saku Mapa. Saku is the head of consortium of the Innovation to Inclusion program. She's a development specialist with extensive experience in innovation management and is based with Leonard Cheshire, the lead organization of the I2I consortium. So Saku, the floor is now yours.
Thank you, Gordon. Okay. So leading the UK aid consortium called Innovation to Inclusion, or I2I, as you've sort of heard up to now, Leonard Cheshire is testing innovative solutions that will increase access to formal employment for people with disability, particularly in Bangladesh and Kenya. So we know that there's a strong correlation between lack of employment and poverty among people with disabilities. But for about 2 decades, there has been a push towards integrating and including people with disability in the workforce. However, the COVID-19 crisis threatens to push back this progress we have made to implement CRPD and achieve the Sustainable Development Goals. So we need to turn this challenge into an opportunity to build back better, ensuring to address barriers faced by people with disability, especially in relating to a sustainable inclusive economy. So in the brief couple of slides I want to focus on one of the key solutions that I2I program is testing in terms of increasing access to jobs for people with disability, which is called the Digital Employment Pathway. I'll also highlight some of the learnings. So technology and digital-based solutions have been key to reducing barriers for people with disability to live, learn, and work independently. And we believe that this need is now greater more than ever, so that people with disability are not left behind in the COVID-19 inclusive economic recovery. The digital employment pathway model is designed to remove barriers, accessible and inclusive barriers faced by people with disability along the entire employment journey at every stage. The pathway was designed based on extensive research that was done in both countries, in Bangladesh and Kenya, as well as discussions with persons with disability and a global literature review as well. We also brought in experience from face-to-face livelihood programs that Leonard Cheshire and the other consortium partners had. I won't go into details about some of the findings of this literature review. It's quite interesting and they are available on the Leonard Cheshire website. We are also in the process of finalizing paper that would be published in a journal. So based on this analysis and experience of employment inclusion programs, the consortium developed a 5-pillar framework called the Digital Employment Pathway. Now this includes digital and technology means to identify people with disability, to register and assess their skills, undertake e-learning modules for upskilling, provide job matching services, and support with workplace solutions. So while the digital employment model was designed in a pre-COVID time, if there is such a term, but it's now more relevant than ever because in the COVID-19 context, the digital employment pathway has additional value by facilitating access to employment services so people don't have to leave their houses. The socioeconomic challenges brought on by COVID-19 also offers an opportunity to find more inclusive responses and lasting solutions to long-standing inequalities. So for example, some of the issues raised by persons with disability in terms of the COVID-19 impact in a survey that I2I did in both countries included closure of workplaces and loss of income, transportation challenges due to social distancing, unable to work from home due to lack of assistive technology and connectivity, lack of measures including hygiene and personal protective equipment. So the digital employment pathway is seen as a solution for disabled job seekers to look for new jobs. For example, if you had lost your job due to COVID, or to upskill yourself and contribute to, which would contribute towards an inclusive economic recovery. So how do we translate that 5 pillars, sort of like, those 5 pillars that I mentioned earlier of the digital employment pathway to a particular country, and how do we contextualize it? So we have sort of like adapted this the framework to Bangladesh and Kenya. They're slightly different, they're not the same, but I'm only going to focus on Kenya for the moment. In Kenya, we needed to identify partners to provide the functions outlined in the digital employment model. So there were 2 options for this in Kenya. One was to work with the mainstream employment platform, or one that was catering specifically for persons with disability. After doing some analysis in terms of the 2 approaches and the sustainability and the reach that each of those options would provide, the I2I consortium fostered a partnership between a government agency focusing on persons with disability and a private sector employment service. So this means Fuzu, which is a mainstream employment platform in Kenya, would be upgraded so that their services, their career advisor services, will be inclusive and accessible. For example, this included facilities for persons with disability to register online, undertake an assessment, upskill themselves through online modules, receive career advice, and apply for jobs. The National Council for Persons with Disability in Kenya, or NCPWD, holds a central database of people with disability and provides employment services for their members. However, the particular portal that they were working on didn't provide the services as, like Fuzu, and also they didn't have the same reach in terms of employers. So by adapting the digital employment pathway in Kenya with these 2 organizations, we brought the best of both worlds. This meant that the digital employment pathway had access to the largest number of users through the National Council for Persons with Disability, as well as access to the largest number of jobs and career support through Fuzu, so that people with disability in Kenya are supported to fulfill their career aspirations. The user journey the users will register on the new employment portal called the NCPWD Career Portal and continue to access the services which are powered by Fuzu's technology and their business model. And I'm really glad to say that the NCPWD Career Portal was launched yesterday. Perhaps some of you would have been able to join us for the launch. I just wanted to share a quote from one of the users of the portal. She said, "This is a platform which builds the confidence of people with disability. The fact that COVID-19 has taken us backwards with employment, this portal gives us the chance to get back into the labor market." So I want to sort of like, end the few minutes that I have really to sort of like, share some of the key learnings from this process of developing an innovative solution and how we sort of like contextualize it and what are the key learnings from that. So there are 3 sort of like, key things I wanted to share. First is about engaging service users and how critical that has been to engage persons with disability as advisors right throughout the process, from the design phase to sort of like, to the implementation. So we followed the Government Digital Services, or GDS, standards for developing a digital product, which includes discovery, alpha, beta, and live phases. So for example, during the discovery phase, we conducted extensive desk-based review and user research to understand the need of disabled people in both countries. So for example, during our research, we discovered that disabled users access internet a lot more from mobile devices than from a regular computer. So as a result, we knew we had to design products that were compatible with web browsers in portable devices. Similarly, during the design phase, we had sort of like, expert group of people with disability who had different types of impairment coming and providing information or sort of testing the portal and advising Fuzu, which was really sort of useful for Fuzu because they had their services up to now were not accessible. The portal's gone live yesterday, like I said, but we are still inviting users to provide feedback so that we can improve the platform. And the content in this portal, such as blogs, etc., have also been developed together with disabled people. The second learning I want to share was really the importance of that public-private partnership. I'm sure sort of like, from what I've said earlier, you would have seen like, bringing those local partners, especially Fuzu and the National Council for Persons with Disability, helped us to increase our reach as well as local ownership. So the National Council for Persons with Disability, for example, has 800,000 members who are registered, and most of them are looking for jobs. Fuzu or like they ensured that we could rely on a trusted and tested digital recruitment tools. They had a proven track record. They had 7 million users who have been using the platform since they started in 2015. And they are one of the top 50 engaged websites in all of Kenya. And thirdly, the partnership provided value for money by bringing the expertise that was needed, the right expertise. So for example, Fuzu understood the needs of the employers. NCPWD is a trusted brand among persons with disability in Kenya and working to promote the rights of people with disability. Lenachesha and the consortium partners had expertise and experience on accessibility and inclusion when it comes to working with tech companies, especially through Lenachesha's partnerships with Accenture and Microsoft, etc. So we also established a steering group in Kenya to enhance the functionality of the platform. The steering group was formed of local stakeholders from the National Council for Persons with Disability, the Kenya Business and Disability Network, as well as the National Employment Authority and representatives from organizations of persons with disability. The responsibility of this group was to steer the development of the digital employment pathway according to the needs of the users. So I just wanted to end by saying, like, we were able to transform what was sort of like, a model that was created based on sort of like, evidence in a piece of paper into sort of like, a live employment portal through sort of like, all the support of the consortium partners. So I really want to recognize all the consortium partners and particularly the implementing partners in Kenya as well. Kenya and Bangladesh will soon be launching the Bangladesh employment portal as well. And I think, it's also, I want to recognize the fact that, UK Aid Connect took this sort of like, is promoting innovation in disability inclusion, which helped us to test this model, which hopefully we can sort of like, expand to other countries as well. Thank you.
Super, thank you so much, Saku, for those learnings and innovative solutions around disability inclusive income generation and livelihood. Of course, this is crucial to allow people with disabilities to recover from crises in general. So continuing in the theme of recovery, we're now going to hear from our last two speakers, Simon Brown and Benedict Witethia from the Inclusion Works Consortium. Simon is the Global Technical Lead for Economic Empowerment at Sightsavers, and Benedict is the Sightsavers Program Manager for Inclusion Works and Disability Inclusive Development Programs in Kenya. So Simon and then Benedict, I think for the last time, I will say to speakers, the floor is yours.
Thank you, Gordon, and thanks, Saku. I did listen into the launch of the Kenya portal yesterday morning, and it clearly has generated a lot of excitement, and that's terrific. But what's equally clear to me is that both consortia are full of innovation. And that's really important right now. The online portal from Eye to Eye, the work we're doing in Inclusion Works on employer disability confidence resources, the IT Bridge Academy we're going to be opening in Nairobi very soon, the first shot approach where we're seeing companies really putting people with disabilities at the front of the queue for employment rather than the back. But for the next few minutes, we're going to be talking about value chains and particularly private sector value chains, and how these have the potential to create very large scale employment for people with disabilities at all times, but particularly right now in this period of economic disruption and recovery. In Inclusion Works, we've taken a fairly broad definition of formal employment, consistent with ILO in recognizing that it's much more than formal sector employment, which of course tends to be more accessible for people with relatively higher levels of education, and normally more urban than rural. Our approach also includes own account workers, so those who are self-employed or running micro or small businesses, and also on-farm employment, so long as farmers are formed into producer groups, which can access higher value markets and national or even international or transnational value chains. That, of course, has the potential then to take us into much more rural spaces and across a much broader group of educational outcomes and livelihood aspirations. We started that in Kenya with the East Africa Breweries Limited as part of the Diageo group, and specifically working with people with disabilities who aspired to a farm-based livelihood. And that pilot has recently finished. Key here is how that pilot has influenced EABL to now to commit to a 3% inclusion of disability across its value chain in Kenya by 2025, and how that begins to influence and has the potential to further influence other subsidiaries of the Diageo group. And we're already seeing that, for example, in Nigeria, and the Guinness brand, the Guinness subsidiary of Diageo, connecting with us and wanting to replicate the Kenya model in its Nigerian context. But also how we see it influencing other companies, not least Kenya Tea Development Agency, wanting to replicate the same approach in its tea value chain and the hundreds of thousands of jobs that it generates. Parallel to that, we see Coca-Cola Beverages Africa in Kenya looking to work with us more on the tens of thousands of livelihoods it supports along the distribution side of its value chain, not least in the retailer segment of that. And also working alongside I2I, how we begin to see Unilever also now looking deeper into its value chain and the opportunity for inclusion in its very large distributor field force in Bangladesh. So great examples of how working within a system of strengthening and building confidence around inclusion, that we then see how the system itself and specifically private sector value chains can bring inclusion to mass scale with us. And with that, I'm going to hand over to Benedict to introduce more voices from on the ground in Kenya. So Benedict, over to you. Benedict, you're muted.
Thank you, Simon. We are going to watch a video, which is an evidence of how Inclusion Works project is working with the East Africa Brewers Limited in Kenya to achieve representation of persons with disabilities in the value chain, and particularly women with disabilities. We are going to witness a live testimony from a video of a lady named Jennifer Atieno, who is a widow, on how this collaboration has impacted her life. She has been a subsistence maize farmer for more than 10 years, and all that time Jennifer has not got any profits from her farm produce, as the maize was all consumed at home. After selling her sorghum produce to EABL, she was very happy since the income enabled her to buy books for her children and some good food for the family. Now she plans to lease additional 1 acre piece of land to extend her sorghum farming. Let's watch the video together.
Before I started growing millet, I was a peasant farmer in the village in Rangwe. I used to grow maize, but the returns were hardly enough to sustain my basic needs. By God's grace, I got into this program, which has significantly helped improve my family's fortunes. I sold 1 bag and 20 tins of millet. I am highly favored and I am so happy with the returns from growing millet. I am happy and I got paid. I bought various household items, food, paid school fees and purchased books for my children. I've started teaching other women. I encourage them to work hard to uplift themselves up. This program is perfect. That was my lesson to other women. After I left Rangwe, I leased an additional acre of land. I'll use this to grow more sorghum in addition to my other farm. I am very excited. The only challenge I face is plowing, weeding, and dealing with irritant birds. I am happy EABL gave me the seeds and fertilizers.
Thank you for watching the video with us. Next, we go to a stakeholder feedback slide. Next, please. These are feedback we got from the Group Corporate Relations Director at EABL. This feedback is from a decision-making level, and it validates Inclusion Works project efforts of supporting EABL in ensuring greater disability representation in their business. This is the influence we want to see across our partner employers, making concrete and deliberate efforts for disability inclusion, and especially embedding their commitments and targets in key organizational policy documents. Thank you, and a nice evening.
Thank you, Simon and Benedict and Jennifer as well. It's so exciting to see the scope of these projects covering so many fields, quite literally fields in Jennifer's case, of income generation. So you've heard enough from me. Thank you to all of the speakers. I'm now going to hand back to my co-chair, Jazz. So Jazz.
Brilliant. Thank you very much. Thank you very much, Gordon, and thank you very much, speakers, for a really great set of presentations and so on. So we're running a little bit over time, but we do have some time to take some of the questions that we've had in the Q&A boxes. So many thanks to everybody who's contributed some questions there, which is great. Ideally, I'd like to get to everybody. We probably won't, but so I've handpicked a couple. So actually, the first one is you, Morgan. So given the diversity of disabilities and therefore disability-related costs, how can these costs be practically assessed and considered in poverty assessment and in determination of transfer or support values?
Yeah, so this is a great question, and one that has maybe not the easiest answer. So I definitely agree that the range of direct costs of disability can vary substantially by impairment type, as well as the context a person lives, and many other factors. So as part of I2I, we are doing some work at looking at how to more accurately capture all of these costs. So there are different methods that are available at the moment. Some of these are modeling estimates. Some of these involve asking people about their expenditures, but truly capturing the full range of goods and services required by people with disabilities and different types of disabilities can be quite challenging. For poverty assessments and in terms of provision of programs, there is an increasing move to separate out direct costs from poverty related programs. So if a person with a disability is poor, they should receive the income support so that they are no longer in poverty, but then separate to them living in poverty, direct costs of disability should be covered. So that could be through a cash transfer, or it could be in kind. So for example, health costs can vary enormously between people that even have the same type of functional limitation. So a very strong social health insurance program could capture the diversity of those costs.
That's brilliant. Thank you very much indeed. Okay, I'm going to move us swiftly on to a question actually to you, Saku. Obviously, the digital employment pathway sounds very exciting and relevant. Could you share some thoughts on some of those learnings, particularly using this in locations with limited connectivity and resources?
Thanks, Jazz. So yes, so we had sort of like, considered, or during even the literature review, there was a lot of like, things that we found which were promising, but also which had sort of like, issues. So what was promising was that both countries were investing a lot in terms of ICT, and there was also ownership in terms of mobile phones, and also sort of like, use of internet in both countries. But we knew that, the connectivity in some of like, the rural areas, or even sometimes some of the urban areas could be challenging. And because of that, there are sort of, maybe I'll probably like, mention three things that, we are working along while we sort of like, promote the digital employment pathway. One is to also partner with, so for example, in Kenya, specifically with Safaricom, or sort of like, mobile phone providers, in terms of being able to send bulk sort of like SMS messaging. So people do not necessarily need to have a smartphone. Secondly, we also sort of like, looking at the option of sort of like, having a dial-in number. So a person could sort of like, call in to register, and then we can sort of like, call them back. So if they sort of like, are not able to access that information. And thirdly, because as a consortium, there are lots of different partners, and we are very, very sort of like, privileged to have World Bank also with us, because in both countries, they're working with sort of like, the government in terms of promoting large scale sort of like, national programs. So we're really looking at sort of like, working with the ministries of ICT, as well as sort of like, those stakeholders, to be able to expand the sort of like, the reach to sort of those areas which currently doesn't. So maybe I'll stop there, because I know you're stuck for time, rather than go on to the others.
Bless you. Thank you, Saku. I am going to ask this one of Johannes, actually, because I think it's very pertinent to what we're talking today. Johannes, you mentioned that establishing and maintaining strong working relationships with organisations of people with disabilities and government partners has proved essential in building sustainable response strategies. Could you possibly share what countries were the most successful in building those tripartite relationships, and what specific elements made that the case?
Yeah, I think basically we have had this experience in all countries, whether it's Bangladesh or Nepal or Kenya. I would say that the really important thing is that these partnerships are kind of made at the level where decision making is taking place, and that it's clear about how and who to link actually. And I think local authorities and local councils, if they have the let's say the authority on kind of implementing measures on the local level, that's really a kind of key let's say level to make these partnerships possible, because they are in the end implementing, even if there's positive policy frameworks in place in a country. And that has worked particularly well, I think, in Bangladesh, but also in Nepal. I think the other point that I would like to make is also how important it is in these partnerships to learn, and coming back to data. So we have seen in Nepal, when the government kind of collected data without disaggregation, and then our program needed to kind of find out with the Washington Group set of questions on where people are. It was really a duplication of effort, and that was another learning. Kind of partnering with governments means also to get governments to use the Washington Group of set of questions and do disaggregation right off the start. Otherwise, persons with disabilities may be too late to access available programs.
That's brilliant. You know, I'm really glad you mentioned the Washington Group questions, because that was one of the questions that I thought we weren't going to have time to get to. Okay, we've probably got about a minute left, but I do want to just maybe give us a general question that everybody has about 30 seconds to answer. So basically, based on the learnings that you've presented today, what would be the one big thing that you would like to look back on on the 5 years from now and say, yep, we achieved that. I'll do this. And Simon, I'm going to start with you as you haven't spoken.
Sure. In 5 years' time, looking back, I would hope that we will see that the system itself has completely taken over the work on inclusion and has brought it to massive scale. That would make me incredibly happy.
Yeah, thank you, Simon. Okay, Morgan.
I would say having a methodology for quantifying direct costs of disability and to have programs that can address those costs.
Brilliant, thank you. Nice and succinct. Saku, what are your thoughts?
Okay, so for me, I would like, people to remember this time not as sort of like, a time that they lost their jobs due to COVID or had sort of like, economic hardship, but it was sort of, it created the opportunities for them to sort of like, try something different or sort of like, look at this as an opportunity to change the system and sort of like, be employed.
Brilliant, thank you, Saku. And Johannes, have you got any final thoughts?
I hope that we don't have to argue anymore why it's important to include organizations of persons with disabilities and disability and disabled people, but that we really have inclusive and enabling systems and processes in place.
That's great. Oh, thank you very much, everyone, for being game on that one, because I didn't warn anybody I was going to send that. Okay, we've had a really good engaging session now, and I just big thanks to all the panelists and those that have submitted questions. We are going to send responses to all those questions that didn't get answered via email, so we'll come back to you on that. But now I'm going to pass over to an old friend of mine, Tom Shakespeare, who is a professor of disability research at the London School of Hygiene and Tropical Medicine. Tom was formerly at the World Health Organization and has been researching with disabled people for more than 30 years. So over to you, Tom, for some thoughts you picked up from today's learning.
Okay, I'll be very quick. This is International Human Rights Day, and it's really important we recognize the human rights of all people, particularly people with disabilities at this time. So far, thankfully, the pandemic has not had a huge effect in terms of its direct effect in places like Kenya and Bangladesh. It has in South America and it has in India, so they're certainly not immune, and it might be terrible in months to come. But the lockdown and the damage to employment has been terrific. What we're hearing from our colleagues in places like Zimbabwe is that a lot of disabled people rely on day labor, essentially. And because people are staying home, doing their own childcare, doing their own gardens and houses and all the rest of it, there are fewer jobs for people who with disabilities and mental health conditions who might otherwise have them. So we need to be very careful about that as we build back. The second point I would make is that in the long term, these economies are moving from informal to formal employment. There will be less artisans, fewer people reliant on farm labor, and there'll be more jobs, we hope. That's what development's all about. And what we need to make sure is that that doesn't lead to more exclusion. There's more poverty proportionately between disabled and non-disabled people in developed countries. We don't want to have that as we move forward in development in low and middle income countries. I think this is a really good, interesting set of presentations and interventions, and I wish them every success and thank FCDO for funding them. So I'll stop there and hand over back to you.
Thanks, Tom. Thanks, Tom. Okay, that's enough from me. I'm going to say thank you very much from me and also my co-chair, Gordon, and pass over to Diana Dalter to close the session. Diana is head of the Inclusive Societies at the FCDO. So over to you, Diana. Thank you.
Thank you very much, Chaz, and thanks for the opportunity to speak very, very quickly. I have the small task of completing the top and tailing of this event by the FCDO. We're enormously grateful to all the chairs, to the panelists and the speakers for their fantastic contributions to the sessions. And we have heard loud and clear today about the importance of the contributions of the OPD representatives, And we've heard some tremendous perspectives today, tapping into their knowledge and learning from their experiences, all of which are incredibly invaluable. And it is imperative that all the work we do ensures participation by people with disabilities and their representative organisations in order to meet the principle of nothing about us without us, and also importantly remain compliant with the CRPD. The feedback from potential service users themselves is clearly a key part of any process to design responses. But I was also really interested to hear about the benefits of the partnerships with private sector organisations. So it was really useful to hear some detail about the activity that's going on in relation to that. So thank you for sharing those perspectives. On behalf of the FCDO, I must thank all of our implementing partners for all the work that you do. I'm sure many are connected here today. When I say all, there are multiple partners working behind those we heard from today. Unfortunately, too many to name individually now, but thank you to you for those people who have joined remotely into this conference. I'm not going to say any more because I think we're clean out of time, but just to stress that the FCDO is committed to funding disability inclusive programmes into the future. It will require revised and republished disability inclusion strategy, and we'll be getting on with that in the new year. So we obviously need to take stock on what actions we can take across the whole of the FCDO, but the way I see it is that there's huge opportunity to do even more. So thank you to everyone for joining the session. Thank you to the speakers. Thanks for the opportunity to allow me to take make a few short closing remarks, and I'll sign off there. Thank you.
Thank you, Diana, Jazz and Gordon. It's been our pleasure to support you today. Thank you to everyone for joining us. We will now end the webinar. Thank you and goodbye.